Can you experience infertility after already proving to be fertile by successfully having a child? Yes. But let's learn a lot more from a reproductive endocrinologist and infertility specialist.
Hello, I'm Dr. Joseph Davis. I'm a physician at Shady Grove, Orlando, and a reproductive endocrinologist.
Before we dive in, I just ask that you like and subscribe. And if you want to talk to your employer about bringing fertility coverage to your workplace, we have resources for you at progeny.com/talk-to-HR. Experiencing infertility after already having a baby is a phenomenon that has a name. It's called secondary infertility.
Oftentimes, the first delivery, you may not have had any troubles getting pregnant, but now you're experiencing difficulties, and it can either affect men or women or both, meaning the causes can be from either side.
So why does this happen?
You're always older the second time around. There are effects of age, health, weight, ovarian reserve for women, and likewise for guys. Gentlemen may have sperm challenges that they didn't have before. They may have undergone medical treatments or had infections and things that would have affected their sperm count that previously wasn't a problem.
So secondary infertility often comes on due to the passing of time. So if that's the case, is there anything you can do to prepare for or even prevent secondary infertility?
Things like embryo and egg freezing when you're not quite ready to have a second child, but maybe in preparation for the future is an option. But there are other causes of secondary infertility that are treatable and preventable so that you can hopefully not have any problems. Things like making sure that you're in the ideal health. That includes getting blood pressure under control, diabetes, if you have these conditions, mindful of your weight and your nutritional status, eating a healthy diet, making sure that you're in an ideal weight, and along with that is exercise. Again, this is for both men and women. Other things like surgeries, D&C procedures or abdominal surgeries, they can lead to secondary infertility, but oftentimes they're unavoidable. Being sort of aware of what may lead to problems getting pregnant in the future is always the best start.
If you've found this video, you might be wondering the next question. When should you go and see a doctor for help?
It really depends on the situation. If you know you have a barrier to getting pregnant, perhaps you had surgery, like your tube's tied, and now you want to have another pregnancy, then you can go ahead and seek care straight away. If you're unsure if you're going to have any difficulties getting pregnant, then we usually use sort of age-related guidelines. If you're under 35, try for up to a year. If you're between 35 and 40, maybe 6 months, and then over 40, just go straight away to seeing a doctor. But it really depends on your individual situation. And I always encourage people to get more information by seeing a doctor, even if it's early in the process, because we may uncover some challenges and find that, okay, you're ready to move forward quickly with treatment due to some other situation.
It's important to remember that fertility doctors are on your side. They share your same goals.
So I think it's important to know that a fertility doctor is really there to be on your team and helping you become pregnant. It's not necessarily that you're signing up for treatment straight away. So I always talk to my patients about, look, fertility is part of your overall wellness, and you should think of building your family just like you would your regular annual visit. It's something you want to be on top of, you want to be mindful of, get good health advice. So coming to see a fertility specialist doesn't mean that you're necessarily going to need treatment or be signed up for a treatment. But even if you do need or find yourselves needing treatment, it's a conversation and a relationship with the fertility specialist to sort of work together for a treatment plan that you feel comfortable with.
If you're experiencing secondary infertility, don't panic. Doctors are trained for this very thing, so don't be afraid to see a fertility specialist like Dr. Joseph Davis from Shady Grove Fertility. Thank you for taking the time to watch this video. If you like hearing from the world's best doctors, please leave a like and subscribe to the channel. And if you want to learn more about Progeny, visit progeny.com/education. Finally, if you want to learn how you can help bring fertility benefits to your workplace, check out our resources at progeny.com/talk-to-HR.